Welcome back to the Physical Therapy San Pedro podcast. This is episode 65, and today we're talking about sidelines, scope, and the EMR question. What sports clinicians need to know before they get on the sideline when an emergency happens. I am your host, Dr. Janae Brown. I'm a sports physical therapist and owner of Physical Therapy San Pedro. And we're diving into a conversation today that every sports clinician working on the sideline or wanting to work on the sideline needs to hear. Whether you're an ATC, a chiropractor, or a healthcare provider, considering event coverage, this conversation is about protecting the athlete and protecting yourself. And today I'm joined by Dr. Ann DeGrey. Dr. Ann is a board-certified sports physical therapist, sports emergency responder, who brings a unique perspective as both a clinician and an educator in the emergency response for sports medicine professionals. So let's dive into it. Dr. Ann, why don't you start by introducing yourself to us, and I can chat a little bit about how we met and how we came to kind of do this podcast together. So tell us about yourself.
Thank you, Dr. Brown.
Yeah.
I'm Dr. Ann DeGrey. I am a board-certified sports specialist, and I am also the clinic director at Modi Physiotherapy in Highland Park. I also own NovaSport Institute, which is a learning platform for physical therapists. I provide mentorship for our sports physical therapists and also teach the emergency response course for any health clinicians that are interested in working sidelines.
Awesome. Yeah, and I took Dr. Ann's course recently. Myself and my team, we hosted here at our center, and I have been on the sidelines for a long time doing sideline care. I initially, when I started to do sideline stuff, I was like, I'm concerned about concussion stuff, so I got concussion certified. And I felt pretty good about like the rehabby things. You know, someone goes down and you're like, oh, they hurt their knee, and I can just check it to see, you know, did they tear their MCL, or can I tell them they can go back in the game? But when it came to like EMR stuff, we all get our BLS, right? We have to have that as PTs. But I was like, there is more I don't know. And I thought, you know, and I had heard such great things about your course. And if you're someone on the sidelines and you're wanting to expand your knowledge and feel really comfortable, this is a course that you want to take. So we hosted and I took it, and I feel like myself and my staff felt really a lot better about things that we didn't know about, like splinting and, you know, taping and wound care stuff. You talked about concussion. You went a lot into like, you know, things that I think we don't think about as PTs that could potentially be a problem, like if you're on the sideline. So yeah, I felt like it was really great. So I'm going to plug that course right now by saying, if you're a PT trying to get on the sideline, I swear it's a great course for you to take, a lot of great knowledge, and, you know, I definitely would recommend it. So, and that's how we came to know each other. And so we're doing some other fun things together, which you guys will find out maybe in the future about. But we wanted to have this conversation together because it's a growing conversation or growing topic, because a lot of PTs are trying to get on the sidelines and cover games and tournaments and athletic events. And there's confusion, right, about scope of practice and liability, and really even like the EMR title, which I know that you've changed how you use that EMR title in your course after you've discovered some things. But I think this is a great opportunity for us to have a discussion about what PTs, you know, need to do in order to get on the sideline and feel comfortable and be able to say that they are, you know, able to respond to emergencies and feel confident. So can you tell us, Dr. Ann, about your background and how you became involved with teaching emergency response for sports clinicians?
Yeah. So when I first started pursuing a career in sports therapy, one of the prerequisites in order to sit for your SCX exam is to take an emergency responder course. Mm-hmm. And of the course that were listed by the California State Board of Physical Therapy, I took courses from Red Cross and a couple of other companies in order to prepare myself to work sidelines and then get the hour sidelines I need in order to sit for the SCS exam. And when I took those courses, I also came to realize that some of the skill set that was required of me working sidelines as a physical therapist from my athletes was missing. So things like athletic taping, wound management, being able to address concussions, being able to address mental health sometimes, or even adaptive equipment for some of our athletes. Those were all lacking from your general kind of first aid EMR courses. And so because of that, I spent some time learning on the field with our athletic trainers, from other doctors, from chiros, massage therapists, different skill sets that I found so useful when I work sidelines, especially when I'm by myself and I don't have other clinician skill sets to help me. And so because of that, I felt like, this was like during the pandemic too, I was like, I have some time, let me put together a course. I actually reached out to the state board. They said that if you follow all these requirements, we'll approve your course. And so I put something together and I started teaching it. And I'm just really happy that I'm able to bring more physical therapists into this field and just spread the knowledge a little bit more and make you feel more confident working sidelines. But at the same time, tell you about, all the pros and cons, right? The different dangers of like overstepping your scope, or how to collaborate with other healthcare clinicians without stepping on each other's toes. I feel like that's really important too. So that's kind of how I got into it.
Wow. Well, first I'm going to say congratulations, because such a huge accomplishment to be able to build a course and it to be successful. I know you've worked really hard to get it out there, and it is really the only, I would say, emergency medicine course that's probably out there for PTs right now. I haven't seen anything else like it. So I think what a huge accomplishment that you did that. So kudos to you.
Thank you.
And thank you for doing it, because I think when things like this come up for us, it just advances our profession in a way that we feel more confident. So thank you for doing it. I think it's a wonderful course. You work closely with clinicians who want to get on the sidelines. What concerns you about how that's currently happening?
Yeah.
What concerns you about the current clinicians that are on the sidelines right now?
Well, just like any professions, there are great ones, and there are some that are not so great, right? And the thing that concerns me the most is when a clinician joins a sideline team and doesn't know what they're doing, right? When an emergency happens, it's like all focus on the athlete or the victim, right? And we want to make sure as healthcare professionals that we provide the best care that we possibly can for that individual. But unfortunately, when you have a non-cohesive team, if there's lack of communication, you don't understand each other's skill set, each other's knowledge, how you can help each other work together, then it's kind of a detriment for the athlete that is currently injured, right? Too much time is going to pass. There's going to be like too many cooks in the kitchen, or maybe no cooks at all, right? So then it becomes an issue for the athlete, and ultimately, like, we're there to protect this athlete, and if we can't provide that care, I feel like that's kind of the scenario that would be the worst for us in our profession too.
Yeah, absolutely. So do you think that you see that the clinicians that are on the sideline right now have the skill set to be on the sideline? Does it concern you that there's a lot that are on the sidelines that don't know how to respond to emergency?
From all the clinicians that I've worked with, I don't really see that as much. But at the same time, I don't work with everyone across the nation, right? So I'm sure there are those who are not as qualified to do that job, and yet they're there. Or it could be the team could not afford a more qualified individual, so they ask that individual to help out, right? So it's not really their fault. But then there are some that are in it just for the title, the swag, the name, the association with the organization, right? And it's kind of like, those are the kind of people that probably scare me the most, because they're not in there to learn, to treat, and to be a better clinician. they're there to advance their self, their name, their title, and for the cool clothes, right? Which is not the best thing.
Yeah, exactly. Okay, well, let's talk about the PT scope of practice, right? Let's talk about PTs versus ATCs.
Okay.
We know that PTs and ATCs, especially in California, but probably across the country, are doing our roles are blending a little bit, right? I think the same thing's happening with PTs and chiros, right? So, but in on the sideline, ATCs have a certain skill set and PTs have a certain skill set, right? So what are PTs trained and licensed to do on the sideline?
Okay, so in general, physical therapists and physical therapy school has nothing to do with the sidelines. In school, we learn about rehab, therapeutic exercises, joint moves, manual therapy, stuff like that. Yep. But if you want to pursue more of a sideline approach or to treat more athletes, then you would have to pursue something in the lines of like a board certified sports specialty in order to have something substantial with a written kind of like scope that you can do stuff sidelines, right? So that I think that's why a lot of physical therapists who are interested in pursuing some sort of like more advanced sports, they go and they get their SES, right? An athletic trainer, they have separate schooling specific for sidelines. We have specific schooling for rehab. And because of that, if I were to work with an athletic trainer and there's an emergency that happens, I would defer to the athletic trainer to be lead, and then I could be as useful as I can be, right? Yeah. So just like in the clinic, if I was rehabbing someone long-term, that athletic trainer would default to me to help an athlete get back to playing versus, them stepping in and taking an ACL patient throughout their rehab, right? So I think that's kind of like the distinction. Also, sideline wise, my course is a brief 18-hour course. If you really want to think about it, it's like an acupuncture working and being licensed, going to school for 2 years to be an acupuncturist versus us doing dry needling through a weekend course. Right. So it's kind of similar in that way where like we could be helpful, we could be useful, but we don't have the same education and skill set as someone that went to school for many years for it. So that's kind of like the clearest distinction between the two. But as an SCS and a sports specialist, we are able to work sidelines because it is a part of the scope, right? So in order to even sit for the exam, you need 100 hours of sidelines experience, 50 of it being a contact sport. So they're forcing you to have some variety in that as well. So there is some aspect of like sideline works if you have an SCS. However, if you don't have an SCS, then you have to be a little bit more careful when you work sidelines.
Yeah. So I think a lot of people don't know that that difference that, an ATC has more acute rehab, emergency sideline training, and a PT has more, rehab, return to sport, training. And so we've talked about this before, but, so when you're looking at a training room, right, it could have athletic trainers in that training room that maybe are great on the sidelines, but aren't necessarily great with the rehab, right? Mm-hmm. Or you could have someone on the sidelines that is really great at rehab, but doesn't have the acute, skill set to respond to an emergency. And so, ideally, I think we both talked about like a PT and ATC on the sideline would be beautiful, right? It's like, it'd be great if we could both be on the sidelines, right? But financially, right, unless you're a huge organization like the Lakers or, the Dodgers or something like that, that have a PT, a ATC, a physician, a massage therapist, all those things.
Yeah, everything.
Everything at their fingertips, right? If you don't have the ability to work side by side with someone who can learn and grow from, because that's the goal. Like being able to be on the sideline and learn from everybody would be amazing because your skill set would advance. But if you don't, you need to have the basic training to be on the sideline, right? Mm-hmm. You need to know how to respond if you're on your own, because there are times when that person is on their own depending on what they're doing, or work together if you're on the sideline with someone where it's a PT ATC and you can go, okay, we're here together. This person needs their ankle taped. Maybe you do that better than I do, but when maybe they need to take them through some exercises and some things that will help them long term or help them feel good right now, I'll take that on. Sometimes that's not the case where you're both on the sideline, and sometimes it is. But you need to be able to step into both and then defer to the person who is basically the expert in the case. Both of you there.
And I think also, like, in an ideal world, we're able to work together, right?
Exactly.
So if the athletic trainer has 20 ankles to tape, they're overwhelmed. Let me do a few to help you out if I know what I'm doing, right?
Yeah.
And then same thing if I'm overwhelmed with providing rehab for 2 or 3 athletes at the same time, maybe there is something that my athletic trainer could help me with and kind of like unload that a little bit for me as well. So that would be an ideal world, right?
Yeah, absolutely. Yeah. And sometimes we're not in an ideal world, which is why getting the skill set matters if you want to get on the sidelines, right? Okay, well, let's talk about the EMR title. What does the EMR title actually mean? Can you clarify the misuse of professional titles in sports medicine spaces?
Yeah. So
you can clarify, but what does EMR officially mean from a state or national EMS perspective?
Yeah, so EMR, emergency medical responder, is at first I thought just like a term, right? I thought that EMR is just the initial version of just a term, but not an actual title or designation.
Okay.
And we throw around that term loosely, like we use ISTEM, MFD, STM, and all that, FRC, like all those initials. But actually, the EMR certification and licensing is something that is nationwide. It is below the title of EMS, EMT. And in order to achieve it, you have to take a state approved course, which is, I think, about 52 hours long, and then pay for the national exam in order to get your EMR certification and designation for you to use EMR behind your name. That's what I recently found out. And I went down the wormhole of researching this because I saw that some of my students were adding on EMR behind their name. And, I did it too because I felt like I am EMR. I am an emergency medical responder. And, I'm an instructor for Red Cross for their EMR course as well. And so why not be able to use it, right? But then now I'm like, wait a minute, let's back up a little bit. And so I actually reached out to the Deputy Director of Leg and External Affairs for the Emergency Medical Services Authority, and they did some clarification for me. So I'm going to kind of read the email that they sent me. They said that, outside of the scope of section 1797.165 of the Health and Safety Code, specifically relating to the certification by the Department of Forestry and Fire Protection, at this time, California does not have a state-recognized emergency medical responder approved process, curriculum standard, certification, or accrediting body or state-approved local EMS agency pathway to certification that would allow an independent teaching entity such as myself or instructor to provide a state-recognized EMR level training or certification. So my specific question with them is, if I taught everyone American Red Cross's version of EMR, would they be able to use EMR then? And that basically answers no, right? So there is no current pathway right now. And I think that's why also when I was looking to see, is American Red Cross still teaching it? There is none across the nation. There's no classes. And I think I'm the only registered instructor to teach that class for American Red Cross at the moment, except I can't teach it because it would be like a semester-long course, and I don't have that time. And then my license for them also expires in August, so I'm probably not going to be renewing that either. So it's a lot of steps to go through, right? And so basically from there, I think what happens is if you're going to take a semester-long course for EMR, you might as well take the EMT course. And I think that's what a lot of people went that route, because EMR is below EMT. The prerequisites to take the EMT and the ENT exam is exactly the same. So why bother do the EMR when you can just do EMT? And I think that's why EMR doesn't really exist at the moment. But because of that, I decided that, I don't really want to continue to use that EMR designation in case for any legal reasons, we're using a title that's not appropriate for us. Again, my course is the weekend course, right? It's not the semester long accredited course by EMS. I just don't want to get anyone in trouble. I don't want to get myself in trouble. And that's kind of why I went down that deep hole of research to make sure that we're using the appropriate designations.
So do you think, based on the knowledge you acquired, do you think that a PT should go and do a semester long, EMT course or a longer course to become a specialist? Or do you feel like that's not necessary to get on the sidelines?
I think that if you have that EMT education and background and you don't have your SCS, that would be a great route to go just because it protects you a little bit more, right? But the only thing with getting an EMT license is that every 2 years you have to take the exam and renew your license. So it's just an additional thing that you have to do, right? But if you pursue your SCS and you have to maintain your emergency medical responder courses, like through my courses every 2 to 3 years, I feel like that is also an adequate pathway, right? So it just kind of depends. We're going to talk later more about like scope of practice, but just protecting yourself to the best of your ability. Yeah. Now, if you want to do it all, that's great too, but not everyone has the means, the time to get all these like credentialing, right? But just trying your best to protect yourself, protecting the patient or the athlete, that's all you can really ask for.
Yeah. But technically, there's no criteria at this point to get on the sideline, right? Technically, like if there's a massage therapist on the sideline or a chiropractor on the sideline, like they could be on the sideline without necessarily any EMR training. There's no like requirement to get on the sideline, right? So right now, the training that you're providing through your course is more about skill set. Like it's more about being comfortable being there and feeling like you can respond, because even having your SCS is not necessarily a requirement.
No.
Your massage therapist don't have
because it
SCS,
all depends
right?
on who hires you,
Right,
right?
yeah.
So the entity or the company that hires you to work for them, they're ultimately responsible for you, right? Mm-hmm. They hired you knowing that you're a PT, you're not an ETC, but they're asking you to do ATC-ish skills, right? So then they're kind of responsible for you because they agreed to that. And you make it very known to them that I'm a physical therapist, I'm not an athletic trainer, but I do have the skill set and I can help in ABCD way. And I have very good clinical decision making, so I will know when to ask for help. So that we don't put the company and your team at risk, right? So they know that. This is more so like your independent PT who decides to like have their own company and get paid to work sidelines to manage like a club soccer tournament or something like that on their own. That's when it gets a little scary.
Okay. So the key takeaway here is, be careful what title you put behind your name, because you could have the training, but in this particular case with EMR, you're not going to put EMR behind your name.
No.
But you will represent like a certification, like when you're on your resume, you're going to list that you took an emergency, maybe medical responder course, or, and you're changing the title of yours, but you've taken the course, you have that skill set. And that is what matters, that you have the certification and the skill set to be able to perform the task needed on the sideline if needed. Yeah. Cool. Okay. Let's talk about malpractice insurance and do a quick liability reality check. So what does the standard PT malpractice insurance typically cover for a PT in terms of in general? And then maybe we relate it to what happens on the sidelines.
Okay. So in general, they only cover what is your definition or scope of practice. So for a physical therapist, whatever the scope of practice that is written for us, that's what is submitted to those insurance companies. Okay. So Sidelines is not on there, technically. There is, aspects of rehab, aspects of certain emergency care, like BLS knowledge, CPR, vitals, and things like that for our physical therapists that work in the hospital setting or in like the nursing home setting, but not so much sports athletes in that relations. So there is some carryover, like if you had to provide CPR for an athlete, that is okay, that is covered. But for us, some of the other things, it's not specifically written. Yeah.
Okay. So what misconceptions do you hear most often related to, I guess, malpractice, or if a PT was, responded to an emergency and they operated outside of their scope of practice? What are some things that you think are important for people to know in terms of that?
Yeah.
Yeah.
So whenever there's malpractice or litigation, they take your highest degree as your skill set. So, for example, if I was a athletic trainer and also a massage therapist, and then now I'm a doctorate of physical therapy, they're going to take the doctorate of physical therapy as the highest form of skill set for your malpractice, liability. But because you have all those other ones to kind of like bolster and support you, it kind of justifies your knowledge outside of physical therapy, right? But let's just say you are a massage therapist first, and then a doctor of physical therapy second, and then you did something sidelines and you got in trouble for it. They're going to say, do you have the training sidelines for this to relocate a shoulder or something like that? And it's like, you only have a background in massage therapy and physical therapy. It has nothing to do with shoulder relocation. So why did you do that and harm your patient? That's where it gets gray, right?
So will the Good Samaritan law protect someone responding to an emergency?
So the Good Samaritan law protects you to respond to an emergency in terms of maybe life or death, right? So one of the biggest ones is someone gets into a car accident. If you do not remove the individual from the car, then that person could, get burned. And so you remove the patient from the car, but they in turn had a spinal cord injury that you didn't know, and then they were paralyzed and they sue you for it, right? This Good Samaritan law protects you in that aspect, that you are doing good to save their life. Now it's like, if you were to really relocate someone's shoulder and you didn't really need to, EMS could have came and taken that individual away, but you did it anyway and you ended up hurting them. The Good Samaritan law is not going to protect you in that case.
Yeah.
Right?
And we talked about like a splinting situation where you're on the sideline and there's a physician there with you. It's PT, it's physician, someone fractures, let's say their radius or ulna. Mm-hmm. You both know that maybe the splint is like the best option there. And if there's a doctor there, that could be something you can do if the doctor agrees to it, right? If the PT was there by themselves, that would not be scope of practice, because we can't necessarily splint in an emergency situation under our license.
Under technically black and white, that's correct,
Okay.
right? But there are instances where you might have to split someone in order to remove them from that location for safety reasons. And if that's the case and you have to split them, then it has to be either, if you're by yourself, you have to make that decision that if you don't do this, it will harm the individual more. And then if you are with, a physician and you guys come into agreement with it, let's say the physician does not know how to do it and you do it, at least you guys have come to that agreement together as a team, right? So it's always in like the betterment for the individual and for the athlete. If you're doing something that there could be another route that could be safer, that's where, you need to make sure that you're making the correct decision.
Okay. So the key takeaway here is you need to know your scope of practice. You need to know what your malpractice insurance covers, especially if you're going to get on the sidelines. You need to understand that, and you need to operate in a way that is covered under your scope of practice and your malpractice if you don't want to have a problem.
Yes. Yes. And right now, some of the malpractice insurance that I have called, you can actually, if you have your SCS, you can actually call them and provide the definition of a sports physical therapist for them to add it and implement it into, their system. So right now, for example, HPSO, which is a common one that we all use, if you look at your malpractice insurance, it'll say physical therapist on there. Like it covers you as a physical therapist. But I have asked them to add sports physical therapist on there as well. So if you have your SCS, call them and ask them to add sports physical therapist so that they could cover that little portion of like sideline definition in sports physical therapy that was written in there so that you can get a little bit more coverage as well.
That's great advice. And I don't have an SCS, but I think even calling them and saying, I just recently got an emergency medical responder. I took a course. I have this skill set now. I'm a concussion specialist. I want to make sure that I'm covered in the event I respond to an emergency that relates to anything like this on this, on the sideline. I think that's probably something that, anybody who takes your course probably should do so that they are covered. That makes sense.
Yeah. And they work the best when you have that literature to send them right away. Because I remember trying to add EMR to it and they had no idea what that was. They were like, EMT, do you want me to add EMT to it? And I was like, no, not EMT, EMR. And they couldn't add it. So then that's when I looked up the definition of SCS and sent that to them. And then they were able to add that.
I wonder if you could just find out, I guess you're going to have to deal with each insurance a little differently, but the goal is do your best to, protect yourself by trying to add whatever skill set you have. And it could be a lot of different things that you have as a PT, right? But just make sure you're covered liability-wise before you respond, right? Okay, so let's talk about, I'm going to be, just for you guys to know, I'm going to be on the USA weightlifting team this year for the first time at the Arnold Strongman and it's Arnold's, what's the full title of that? It's just the Arnold Sports Festival. That's what it is. Arnold Sports Festival this year. I have gone to the Arnold Sports Festival multiple times as the PT for Martins Lacey's. And so I've been on the strongman side, super comfortable with all the strongmen. I know how that works, but I've been his sort of PT, not necessarily on the medical team for the USA Olympic, any USA staff on that in that way. So I'm doing that for the first time this year. And so let's talk about what that team, like what does the team on the sideline look like? Because Dr. Ann has been on the sideline with the USA weightlifting team multiple times, and she's done it in other capacities as well. But I think from my understanding, speaking with you maybe have been the lead on the team multiple times. And we've talked about sort of in an emergency situation, how that team would respond depending on what players are on that team. So what a team look like, and what should the chain of command look like on the sideline when you have a team of people?
Yeah. So just backtracking it a little bit, I first joined USA Weightlifting back in 2017 at one of their events. And I remember working at the event, I had to be in the back in the tent. So we have a medical tent in the back where all of our providers are at. The athletes come in, they kind of like sign in and request some sort of treatment. In our medical team, there are physical therapists, massage therapists, chiropractors, physicians, fellows, and athletic trainers as well. So kind of like a very cohesive group of different skill sets. Yeah. And so some of us are in the tent, and then we have our physicians and some of our chiropractors sitting in the front managing the platforms. So usually there's either 2, 3, sometimes 4 platforms where the competitors are competing, and there's always eyes on the platform in case something were to happen on the platform. The rest of the team are in the back, and they're providing some sort of, medical care for any athlete that requires it. And I got tired after the second day of just like constant working on patients. And I remember asking the medical director at that time, is there any way I can sit up front in the platform just to watch some of these competitions? And he said, no, only physicians who are trained to manage emergencies and chiropractors who have taken a certain emergency course as well are allowed to sit up front. Everyone else needs to work in the medical tent. And I asked him, well, if I got my SES and I gave you the definition of that, and I take my emergency responder course and I have some training in that, would you let me sit in front then?
Pretty please?
Yeah, pretty please. And he said, yeah, I'll think about it. Right. And so after I got it, I sent it to him right away. And I remember at one of the events, he asked me if I wanted to sit up there for a couple hours. So that was the first time I feel like any PT was able to sit up front.
And what year was that?
Man, maybe right before the pandemic.
Okay.
So
2019.
Yeah, 2018, 2019. I remember it was in Canada.
Okay.
Yeah.
Okay.
And so after that, I worked for him for another couple years. Maybe this was 5 or 6 years into working with him. And there was a meet in Pleasanton, California. And he asked me, he said, you know what, all the physicians are new who's going to be on that medical team that day. And there's only another massage therapist there. Would you be willing to work it, and would you be willing to lead it? And I was like, really?
Now he's relying on you.
I was like, he's asking me as a physical therapist, knowing I'm not a physician, and there are other physicians that are going to be there. So I was like, of course, yeah, I'll do it. And so since then, I think I've gained the trust of, the medical director, and he allowed me to lead it, be medical lead. But even as medical lead, I knew scope of practice wise, if an emergency were to happen, if it was something outside of, my scope, then I'm going to defer and call my doctors in to help me, right? Even though I'm leading it, doesn't mean I'm responsible for everything, right? But it's more so you're responsible for the decision making than the skills of treating itself. And so I knew my team, I knew who was strong at what, and when something were to happen, when emergency happened, the two physicians were straight on to the scene, and they were able to manage it right away. So kind of again, going back to knowing your skill sets, right? So your initial question was how does it work? So that's kind of we have our platforms in the front. We have our medical staff who has some emergency background in the front to watch platforms. They also know to communicate with the back when an emergency happens. If they need a doctor, if they need something, we substitute in and out between the medical tent and the platforms as well. So there's very clear communication. And then prior to all the competitions, you would sit down with your team. Your medical lead would get everyone together. You guys would introduce each other. You would understand each other's skill set, kind of do a quick walkthrough of what an emergency would be, go through the emergency action plan, emergency access, where exits are, who to communicate with, learn how to use a walkie-talkie, and just kind of have all that ready to go so that when an emergency happens, everyone is working cohesively and very quickly as well. So that's really important.
So now that transition has happened and you got to get next to the platform, it sounds like you've opened up that window for a lot of other professionals to do that. Maybe that it seems like now it's more of a who has the experience and the skill set and the leadership skills to be on the platform or near the platform to be able to delegate who responds to what. And and maybe that is something that you were able to change in the mindset. So. Yeah. Because it sounds like we talked about earlier, you were talking about a really great skilled massage therapist that is on this team. And that person's been working a long time, and that might be that person that's doing some of that delegation, right? Because it's like you said, new doctors on the team, new people on the team. It's really about who's been here and done this multiple times that knows best and can respond and has maybe
and make
been able
decisions
to demonstrate.
quickly.
Yeah, good decision maker, because that skill set is different from just being a PT or being a physician, right? Like we talked about, a physician is a physician, but that physician could be an orthopedic surgeon on the sideline. They don't respond to emergencies every day, right? They're not in the ER, or someone who
a pediatrician or something that is in the office most of the time and not really working sporting events.
Exactly. So it's going to be really the leadership should come from the person that has the most experience and kind of knows who to delegate. And then again, leaning back to scope of practice, okay, I'm the leader on this team, or I'm leading, we've determined as a team that I'm a lead, but I'm going to be the one who knows what everybody's skill set is. So in the emergency situation, I know who to call in first and who to get there first. And if I have to be that person to be there first, I'm comfortable with that because
At
I've
least
done
you
that
know what
before.
to do to start off,
Exactly.
right? And then who to call for next,
Right. Yeah.
I mean, what you're going to find at the weightlifting event is like whoever has the most skill set to do hands-on stuff with athletes, they tend to like to be in the back because the athlete demands them, right? And then some of the doctors who don't really know how to do a lot of the manual stuff or taping or like bandaging, they will sit up front in the platform until we need their assistance and we do a swap. Or if, the PT is tired and they need to just sit for a second and then we'll swap around. So skill set wise, we still place individuals in areas that they're the strongest in, but we like to do a rotation so that no one burns out, no one fatigues, and everyone gets to try a little bit of something.
Yeah. So you're a PT, you're in the back, you're doing the stuff you love, right? You're doing PT, right? But then someone goes down on the platform and you need an AED, you need to call 911, right? You need to contact, a family member, you need to start CPR. Like, you can't do that by yourself. You're calling on the rest of that team to be in sort of delegating who does what once you're on that platform. And that's where, like, all hands on deck. You need more than one hand. You need multiple people who know how to do that and respond to that. And that could be one of many situations where you need some hands on deck, right?
Yep.
Yeah, sounds amazing. Sounds fun. Sounds like...
I'm hoping you don't get that much action because we always hope for, when we don't have to work so much, that's a good day. It definitely does happen.
Yeah. I mean, I love doing PT. I love doing rehab, and I love helping an athlete stay in the competition when they're struggling. So that's probably my best skill set. Someone's like, feels like they can't go back on the platform because they're having radiating pain into their thigh. I'm like, okay, how can we get rid of this really quickly to get you back there right now? Yep. That's what I love to do. But, learning all this is fun because it's like being able to respond like that and being able to respond and help someone in an emergency situation is a great skill set to have, right? And so it's gonna be fun. I'm excited for it.
Yeah.
So I guess the key here is, if you have a strong team, you're going to rely on good communication, clarity. What does everybody do? Not ego, right?
Ego.
And respecting, each other's rules to protect the athletes and to protect yourself.
Yep.
Right? Is that the key?
That's the key.
That's the key. Okay. So let's talk about why emergency training still matters. So we talked about a little bit about the PT education. You mentioned that it falls short in emergency situations, but why are sports emergencies different from clinical-based care, and why should high-quality supplemental emergency training, what should high-quality supplemental or emergency training focus on? Like in your course, what do you focus on?
So obviously, the meat of it is understanding BLS. Number one, right? That's the life-saving part of it. And I feel like as healthcare clinicians, we do take it every 2 years, but we don't get to use that skill for 2 years. Yeah. And when an emergency happened, any hesitation is life-threatening for that individual, right? So number one, that kind of emergency care, recognizing when it is that type of emergency. So it could be they collapsed because they had a quad rupture, or did they collapse because they had cardiac arrest, right? So being to identify between the two, one is a real true emergency and the other one, we have a little bit of time, right? I feel like that's really important. That's what I really big emphasis in my class is the life-threatening stuff. But then at the same time, there are certain topics that are lacking, and I feel like we need to focus on things like mental health. That could be a big contributor to an athlete's performance. Topics of different skill sets like taping, first aid management, and not just slapping a Band-Aid on a person, but how can we stop a bleed and return an athlete to play with this bandage technique that you put on, right? Can they run in this bandage technique, or is it just going to fall off? Like, what's the point of putting a Band-Aid on, right? So those kind of skill sets. Also the legality behind it, the ethics behind it. So a lot of things that we spoke about just now, scope of practice, when is it appropriate to do something? When is it necessary to defer to someone else? So learning that, and then how to be as useful as you can in a team.
Yeah. And splinting is something that you cover in your course that I think is not covered anywhere else other than I think in PT school we see splints and we know how we kind of learn maybe some schools teach you a little bit about splinting because you might more of a specialty, like this is if you wanted to learn how to splint. But I think if not every school is doing that, I think it's maybe a day if you have access.
I remember in school we learned about creating more permanent splints for rehab. So utilizing plastics that are like moldable, and you need to like dip it in warm water and cut it and all that stuff, right?
Yeah.
But this is more emergency splinting. So how can I use a piece of cardboard, newspaper, whatever that's necessary to stabilize the individual to transport them to safety? That's more so the skill set that we need sidelines. We're not going to bring out tongs and like a hot plate to create.
We're not making splints right there. Like, okay, let's mold this to you because we're going to send you home with this.
Yeah.
Spine boarding was something that I did not learn in school. And, we talked about like, how many times has this happened? Like, isn't probably not something that's going to be frequent, right?
No.
But having the knowledge base of what to do and how to do it. Yeah. You talk about that in your course.
I think most settings will have access for EMS to come in for the individual. So if it's an emergency situation where the individual needs to be spine boarded, most likely we can stabilize them where they're at, and then EMS can come to you, right? So that takes like one aspect of liability away from you. But, I've worked in situations where the football field is on a hill and EMS truck cannot get up to the hill. You have to utilize a golf cart to get down. And so if the individual is spine boarded, there's no way, or if not, they're not spine boarded, there's no way for paramedics to get up there. So you have to spine board them or put them in the golf cart to get them down the hill, right? So
that makes sense. Yeah, and then I guess you do cover a lot of just different internal things that could happen to someone, or things that we don't think about as PTs that in terms of symptoms like, an athlete might have, and, just trying to figure out what that might be. Although when you have a physician there, yes.
Organ injury is usually a big one. Like if they get hit somewhere in the abdominal area. And then also being able to tell, is it like an orthopedic musculoskeletal injury, or could it be more systemic? Or could it be a history of something, like if someone was more anemic versus like a muscle cramp, so things like that.
Yeah, those are great things too. And then, of course, the taping perspective, which, some PT programs now are spending time teaching PTs how to do athletic taping, but, there's a lot of PTs that don't know how to do athletic taping. So covering the primary taping techniques that you'll see on a sideline, with an athlete. So lots of great fill-ins for an education for someone who does not have that education as part of their degree, or, in a course they took. So, but the key here is that you can, again, your training improves your readiness to get on the sideline, but it doesn't change the title. You're not an EMR. You don't want to put EMR behind your name, but you are trained to be an emergency sports sideline, responder.
Yeah, this is this is in an intro course. This is for you to kind of like wet your beak and understand what it takes to work sidelines, what skill sets are needed to work sidelines. And then if it's something that you want to pursue, right, then it's volunteer time, shadowing, getting as much experience as you can, maybe taking a couple other courses. The only way you can learn is by doing, and by doing with someone who knows what they're doing really well, right? And so I think I would advise all my students, like, try to volunteer as much as you can, and try to like practice your skill set as much as you can.
That's great. Again, check out the course. It's worth your while if you're trying to get on the sidelines. Let's close and talk about just the most important thing, which is protecting the athlete and protecting yourself, right? So if we were to say one or a couple things that clinicians should verify before stepping on the sideline, what would you tell clinicians to do?
I would say number one, get your malpractice insurance, right? So if you're working full-time as a physical therapist somewhere at a clinic, you can get a part-time malpractice insurance to work outside of the clinic, right? And it's very general. I say outside of the clinic because, again, there's no true definition of like the sideline work coverage. So your clinic is only going to cover your malpractice insurance while you're working the 40 hours there. But outside of that, they wipe their hands clean of whatever else that you do. So whether that be home visits, personal training, sideline coverage, volunteering, that's kind of all on you now. You're not protected by your work company anymore. So get your own malpractice coverage. Know your team that you're working with and their skill sets. So that's really important. And making sure that you practice and start at a lower level, lower risk event, Sidelines, and work your way up to a more professional, more maybe collegiate standard, Olympic standard event. If you start off too high, too advanced, and you don't know what you're doing, or you're not useful and you're not helpful for the team, you could easily not be invited back ever, right? So there is definitely, stepping stones to getting there. And when you work for the highest level athlete, they demand the highest level of experience. So try to get as much experience as you're under your belt so that when you do step onto that scene, you are as helpful and as useful to the team as anyone else, right? You don't ever want to drag anyone behind. So, and then you also don't want to get blacklisted.
That's not good. Yeah, you want to be helpful, but you want to make sure you know your place and that you build, your credibility, along the way, so that you're someone that you can be relied on, right?
Yep.
So final message is, getting prepared. Having preparedness means knowing your scope, knowing your role,
Yep.
and knowing where you're covering and how you're covering that event. Not just having good intentions, but these things are really important for you to protect yourself and protect the athletes that you're working with and the people you're working alongside as well. So, Good stuff. I'm excited to do Arnold's and help the USA weightlifting team. So I'm excited with that opportunity. So
I know, I'm excited for you.
Yeah,
I kind of wish I can go now.
Yeah, we could be together. I know. Can you go, please? Maybe no, it's not gonna happen. I'm like, no.
Maybe next year.
Yeah, maybe next year we do it together. Yeah. Well, if this is your first time tuning in, thank you for joining us. We have 64 previous episodes that you can go tune into on YouTube, on our podcast that is on any place you listen, Apple, Spotify, Amazon. So go check those out. We talk about sports physical therapy, performance, and real world clinical practice. If you found this episode helpful, please subscribe to the podcast, leave a review, share it with a colleague that might want to do some EMR training or is interested in emergency medicine and getting on the sidelines, because we think these conversations are really important and will open up opportunities for people to be able to get on the sidelines and help support. There's a lot of opportunities to get on the sidelines. I mean, even at the college youth level, there's so many places where people would love to have a clinician on the sidelines that understands how to support. So lots of opportunities. You just need to get that training and understand what you're doing. You can find links in our show notes to the Physical Therapy San Pedro and NovaSport Institute. So all of our social links will be in the show notes, and ways to get information about our Instagram, Facebook, website, all that stuff will be in the show notes for you. And I think that's it. Did you like to close with anything else?
No, I think you said it all.
I said it all. Okay, well, thank you guys for tuning in. We'll see you next time. Bye.
Bye.